Well, good evening, everybody. Welcome to another edition of RX Question Lab. I am your host, Jeff, and I am going to be pleased to walk you through this session, which is going to focus on cell biology. So, if this is your first time here at Question Lab, we want you to just settle in and get ready to engage with the questions that we're going to be laying out. Our goal here is to help you understand, how to dissect USMLE board style questions and how to pick out the elements of the question that are important and how to get to the right answer. And as a part of this, we're going to be supported by a number of important people, including my co-presenter tonight, Dr. Paris Vicaria. Paris, would you like to say hi to the crowd?
Yeah, thank you, Jeff. Hey guys, my name is Paris. I am a dermatology resident here at UT Southwestern in Dallas, Texas. I originally graduated from pharmacy school in Missouri and then went back home to Michigan to do medical school. And I also am with USMLE-Rx, so I work as an RX coach. So I work one-on-one with students such as yourselves to help prepare you guys for the USMLE Step 1 and Step 2 CK as well. And I'm happy to help lead tonight's session.
We're going to tell you a little bit more about RX Coach as the evening progresses. But I just want you to know that the methodology that we use here in Question Lab reflects the same strategies that we that we suggest within our RX coaching sessions. So again, the main thing for us is to be methodical, and in fact, the way that we structure things here is methodical. So we're going to go into our first question of the night, and what you're going to see first of all is that we cover up the answer choices. And we do that by design. We really, if with the answer choices, there is the opportunity that you could get, you get derailed. You could get spooked by it if you see, a distractor that you don't recognize. So, what we want you to do is use, a deliberate method of answering these questions. And the first thing that we do is we read the lead in first, and the lead in is what is basically the question here. So in this case, the lead in is which organizational unit represents the structure most likely to be defective in this patient. So from there, we then go back and we read the vignette, which is the main body of the question. So we'll go to the vignette. A 25-year-old man comes to his physician because of an upper respiratory tract infection. He says he has experienced 4 other upper and lower respiratory infections this year and frequent bouts of otitis media. He was diagnosed with bronchiectasis as a child. He also reports that he and his partner have not been able to conceive a child after trying for 6 months. Genetic testing for cystic fibrosis is negative. Nasal nitric oxide is low. So again, the question, which organizational unit represents the structure most likely to be defective in this patient? And as you think about that, we'll ask, how many steps you think it would take to get to the answer. And I'm going to turn it over to Paris to walk through it. Paris?
Yeah, thank you, Jeff. So first, let's go ahead and show you what we think are the important clues in this vignette and the lead-in. Okay, so let's start with that vignette. So generally, one of the first things they're going to give you are demographics. In this case, we're told this is a 25-year-old man. So it's always important to take note of that, highlight that, because that's going to really start to clue you in as to what things to think about, what things maybe you can push a little bit to the bottom of the list. Then they'll usually tell you, why did the patient come see the doctor? Why did they go to the hospital? Why did they go to the ER? In this case, it's because of an upper respiratory tract infection, okay? In this case, they gave us some other past medical history. Always important to take note of that, especially as you can see there, kind of have a theme, a lot of infections, right? So that's, you should be highlighting that. They give us some more important social history and medical history about not being able to conceive, certain genetic tests, nasal tests. So all of which you do not want to miss. You definitely want to pick up on those clues, okay? And then you also want to kind of start working into tying in those clues. So as Jeff mentioned, you want to take a quick pause after those sentences and really start to ask yourself, okay, how does this fit into the big picture, okay? Now, if you look at that lead-in, you'll see there that we've highlighted what we think is important in that lead-in, and specifically they're asking about an organizational unit that represents the defective structure, what we think is most likely the defective structure, okay? So how many steps is this question? I think that's a great question. I think one, we need to figure out what is the condition that is going on in this patient. Two, what is the structure that is defective in that condition? And then three, maybe you could argue that there's a additional step of, what are they talking about with organizational unit? So I think one, what's the condition? Two, what's the defective structure? And three, what is that organizational unit? Okay. So let's go ahead and let's take a look at the answer choices. And what you're going to see here are 5 answer choices. And so what we recommend is that when you're going through these answer choices, that you actually start at the bottom and that you work your way up to the top. A lot of times we'll work with students who they'll start at the top, they'll see something they like, and they'll select it, and they may get it wrong because they didn't go through all the answer choices. So doing it this way prevents you from making that mistake and prevents you from biasing yourself. So let's go ahead and do that now. So I'm going to read it from the bottom and work my way up to the top. Answer choice E, tubular arrangements of linked heavy chains that slide against one another. D, heavy and light protein chains linked by disulfide bonds. C, collagens and alpha chains in triplets. Collagen alpha chains in triplets. B, cells with multilobular nuclei and enzyme-filled granules. And A, adjoining E-cadherin molecules with actin filaments. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer here. And we'll talk about it in just a few seconds.
Okay, thank you, Paris. And again, we've got the question up. Go ahead and choose the answer that you think is correct. That answer choice E kind of got cut off. So again, it is the tubular arrangements of linked heavy chains that slide against one another. We always recommend that you take a shot with every question. Never leave a question unanswered on an exam. You're never penalized for guessing. And within the realm of Question Lab, we're here to learn. So again, let us know what you think the right answer is, and we are going to share the results here. Just a second. About a little over half of you have voted. Let's go ahead. Everybody make your selection, and we will dig into this item. Okay, well, we've got over 70%. So I'm going to close the poll, and we're going to share the results. Almost half of you went with option E, tubular arrangements of linked heavy chains that slide against one another. But quite a few of you also went with option A. So didn't get anyone to bite on answer D. So with that, let us close the poll and answer the question. And the answer is, it is E, tubular arrangements of linked heavy chains that slide against one another. Congratulations, all of you that got it right. And for everyone, let's dig in and let Paris explain how we got to that answer. Paris?
Absolutely. Thank you, Jeff. Nice job. Definitely a tough question here. So let's take a look at what's going on back at this vignette. So we know this patient has a history of frequent infections, especially respiratory infections, right? On top of that, we're told specifically this patient has bronchiectasis. How is that different? Well, that's specifically destruction of the small bronchioles, and that can happen with repeated infections. So now he's actually getting destruction of those small bronchioles, and that's called bronchiectasis. Okay. This patient also possibly has apparent infertility, okay, not being able to conceive. So this patient might have primary ciliary dyskinesia, okay? This is where cilia throughout the body are dysfunctional, okay? So let's go ahead and take a look at the next slide. We have a table from first aid there. This is kind of going over the cilia, okay? And you can see there on the very right, Cartaginer syndrome, okay? You can see how patients with that can have recurrent infections, bronchiectasis, infertility, and you can see that there's that lab finding at the very bottom. It's a newer test, the decreased nasal nitric oxide, and that's used as a screening test for this syndrome, okay? Now, in this condition, as you can tell, there is a defect in cilia, specifically with the dynein, okay? So that's why you get poor mucus clearance from your lungs, okay? Dynein arms, as you can see there, now going over to the cilia structure, you can see there looking at that third bullet point, axonemal dynein. It's an ATPase that links peripheral 9 doublets and causes bending of the cilia, okay? So dynein arms are pairs of linked heavy chains, and these linked heavy chains are arranged in tubular arrangements. They slide against each other to create a whipping motion, and that's kind of what causes the cilia to create movement, okay? So if we go back to our answer choices, you can see there how answer choice E is the best answer. We have tubular arrangements of linked heavy chains that slide against one another to create that propulsion, okay? Answer choice D would be getting at something like antibodies. Antibodies have 2 heavy chains and 2 light chains, and they're linked by disulfide bonds, okay? A defect in antibody structure could cause recurrent infections, but that wouldn't explain the fertility problems. Answer choice C, this would be getting at collagen alpha chain, so a defect in collagen structure, and that could cause something like osteogenesis imperfecta or Ehlers-Danlos, but hopefully you're able to see there's not a lot of connective tissue issues in this patient. Answer choice B, this is getting at neutrophils, so a neutrophil disorder, okay? So maybe a immunodeficiency with neutrophil disorder like chronic granulomatous disease, but again, also wouldn't have infertility issues. Lastly, answer choice A. Adjoining E-cadherin molecules with actin filaments. This would be an example of zona adherens, okay? And this is something you can see in a variety of tumors, but not specific to what's going on here. So hopefully you guys were able to pick up 1 on the diagnosis here, 2 that they were cilia, that was a structure, and 3 the organizational unit of that cilia. So hopefully you can see how this is a nice 3-step question here. Nice job on this question.
Yes, definitely a good warm up for tonight. Nice little 3-stepper to get those synapses firing. Again, this is cell bio. I know some of you, it may have been a while since you've been digging into this, and we know that some students struggle as they prepare for STEP because it has been a while since they've wrestled with some of this. So you can see how they use this type of content within these items. So either way, good way to start off the night. So we are going to head to question number 2. And again, we are going to start by reading the lead-in. Further workup for this patient would most likely show which of the following abnormalities. Okay, with that in mind, let's read the vignette. A 35-year-old man comes to the clinic because of shortness of breath, which has gotten progressively worse over the past several years. Physical examination demonstrates expiratory wheezing bilaterally and increased work of breathing. Serial pulmonary function tests reveal gradually increasing total lung capacity and residual volume. An X-ray of the chest is shown. Further workup for this patient would mostly show which of the following abnormalities. And again, we'll ask you to think about how many steps it would take for you to reach the answer. And while you're doing that, we'll turn it over to Paris. Paris.
Thank you, Jeff. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. So again, demographics. So now we have a 35-year-old male, okay? Why is he coming to the clinic? Shortness of breath. On top of that, they give us some time frames. So a lot of times they'll tell you, it's been going on for a week, a year. So always important to make note of that duration, okay? Great history of present illness or HPI questions, okay? They give us some physical exam findings and some pulmonary function test findings. Obviously, we can tell that this is important because there's an image and x-ray of some lungs there. So definitely want to make note of that and highlight that, okay? So then they're asking us, further workup most likely show which abnormality. So I think we've got a couple steps here. I think one, we've got to figure out maybe what's going on, maybe what's the diagnosis, what's the condition, and then maybe what else would we see on further workup. So I think we have maybe a two-step question here. So let's go ahead and take a look at those answer choices. Once again, we're going to start at the bottom and we're going to work our way up to the top. Answer choice E, elevated alanine aminotransferase and aspartate aminotransferase. Answer choice D, decrease in functional residual capacity. C, bronchoalveolar lavage fluid with a positive silver stain. B, blood pH of 7.33 and a bicarbonate level of 18. And A, anti-neutrophil cytoplasmic autoantibodies. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer. We'll talk about it in just a few seconds.
Okay, thank you, Paris. Again, the poll has been launched. Go ahead and make the selection that you think is right. And I think we've got everything at the last term in option E got cut off. That's aminotransferase. So again, this is always kind of think about the strategic way that we advise you to engage with these questions. Once you get your rhythm set, once you have a dissection strategy that you can continue to practice, then it'll become second nature. So looks like about a little over half of you have voted. Let's see if we can get up to that magic 70% mark. An interesting breakdown when it comes to what folks are voting on here. So this will be a good one. Okay, with that, I think we've got 2/3 have voted. So I am going to go ahead and close the poll, and let's take a look at the results here. So this is a fairly even breakdown. So almost a third of you chose B, blood pH of 7.33 and a bicarbonate level of 18. And in second place was E, but also got some votes for choices C and D. So no clear majority here amongst the crowd tonight. So I'm going to hide the results and reveal the answer. And the answer is E, elevated alanine aminotransferase and aspartate aminotransferase. Well, why is E the correct answer? To help us with this, we're going to turn it over to Paris. Paris?
Thank you, Jeff. Yes, definitely another tough question. So let's take a look at what's going on. Well, this patient has shortness of breath, and you can see that those lungs, well, those don't look like good lungs. And this patient's only 35, right? This has been going on for a few years, so definitely chronic, okay? I would say if you see how dark those lungs are and just how wide from top to bottom they are, I'd say that the patient has hyperinflated lungs, okay? We also know that pulmonary function tests show that over time, his total lung capacity has been increasing, okay, and residual volume as well. Because of that, and because he's a young patient, one thing you want to think about is alpha-1 antitrypsin deficiency, okay? He's likely to have what we call a pan-acinar lower lobe predominant emphysema because of alpha-1 antitrypsin deficiency. So let's take a look at the next slide, talk a little bit more about that. Alpha-1 antitrypsin deficiency, it is a uncommon but board fodder question as well. That is a autosomal condition, okay? These patients may also have cirrhosis, okay? And because of that, you may see elevated ALT or AST levels because that dysfunctional alpha-1 antitrypsin accumulates in hepatocytes, which then causes liver damage, okay? Now, AAT is where alpha-1 antitrypsin is normally secreted by the liver, and it acts to neutralize elastase activity in the lung. So if you don't have that, elastase is just going to go crazy, and it's just going to start causing emphysema. You're going to have loss of elastic tissue, and that's not good for your lungs, okay? So let's go back to our question, our other answer choices. We'll take a look there. If you were thinking about some of the other answer choices, let's talk about those real quick. D, a decrease in FRC. This would actually be consistent with a restrictive lung disease. But this patient, as we can see from the hyperinflation and the total lung capacity, has an obstructive lung disease. So opposite categories. Answer choice C, a positive silver stain on BAL, you would see that in potentially invasive aspergillosis, so an infection. Not really the process we're being told about here. Answer choice B, a low blood pH and bicarb level. This would be metabolic acidosis. So with these symptoms, you could have shortness of breath, wheezing, but it wouldn't really explain the X-ray findings and wouldn't explain the chronicity or the pulmonary function tests as well. And lastly, ANCA or anti-neutrophil cytoplasmic autoantibodies. You could see that in certain vasculitides, such as granulomatosis with polyangiitis. It used to be called Wegener's granulomatosis, but we're moving away from that, and we're moving away from those eponyms. So granulomatosis with polyangiitis, or GPA. You can have pulmonary disease, but you should also have other issues like renal issues. And we're not told about that. So answer choice E would be the best answer here, but definitely a tough question.
Okay, thank you, Paris. Yeah, that's good responses out there. Again, if you've got questions for the team or questions about any of these, let us know in the question box. We are going to take a look at our question 3 and 4 coming up here in just a minute, but I do want to mention a couple things. One is we do have a raffle at the end of the evening, so make sure you stick around. We are actually going to be announcing the first winner of the special RX for Life giveaway that is connected to our back to school special. So again, hang out for that. We're going to also have a special prize for one of you in the audience tonight. But we do want to mention that RX Coach is the main reason we are here, right? We want to help you improve your game. And with tutors like Paris, tutors like Brian, we're working with students to help them prepare for step 1, prepare for step 2 CK, prepare for COMLEX, prepare for CBSSAs. There's lots of different exams, and depending on where you are on your journey, there's a coach for you. There's a coach that is ready to help you take it to the next level. Again, you can see that our student satisfaction rating, it's been a remarkable 4.9 here for most of the year. And we really we pride ourselves on meeting the needs of every student that comes to us. Here at RX Coach and USMLE-Rx, we've been preparing students for over 30 years, whether it was through first aid for the USMLE Step 1 or through USMLE-Rx or through our coaching service. Our goal is to get you to where you want to be. And whether that's getting a specific score or getting to the residency of your dreams, that's why we're here. So again, with our what differentiates us is that we have our own 160 question assessment that we give to each of our students, and that helps us put together the personalized study plan, one that meets your needs, right? One that is reflects your strengths and the areas where you're challenged. And again, we use a one-on-one approach with tutors that go through a rigorous RX certification process. And as a plus, you'll also get access to all of the core USMLE-Rx resources, including RX 360 Plus, which includes the bricks. So if you are ready, go to rx-coach.com, and we dropped the link in the chat. You can set up your free consult today and let us set up a plan so that you can get to the next level. Okay, so let us go to question number 3. And again, we are going to start with the lead-in. This child's enzymatic defect occurs in an intracellular organelle that normally performs which of the following functions? Now, with that, to kind of frame your thinking, let's read the vignette. An 18-month-old girl is brought to the physician because she has a hoarse voice and is unable to roll over or sit unsupported. On physical examination, she is small for her age, with club feet, coarse facial features, and enlarged gums. She is diagnosed with a condition caused by an enzymatic defect in N-acetylglucosamine 1 phosphotransferase. So again, the question, this child's enzymatic defect occurs in an intracellular organelle that normally performs which of the following functions? So think about that as I turn it over to Paris. Paris.
Thank you, Jeff. So once again, we will go ahead and show you what we think are the important clues in this vignette and the lead-in. So starting off, now we have a much younger patient, an 18-month-old girl. And again, they're giving us reasons for why she's coming to the physician, okay? Always important to make note of that. Additional physical exam findings. So very important exam findings. You do not want to miss those clues. And then they're generous enough to tell us that she's diagnosed with a condition with a certain exact defect, okay? So I think we've got a few steps here. The question is asking us, the enzymatic defect occurs in an intracellular organelle that normally performs what function? So I think we've got a couple steps here. I think, we know what the enzymatic defect is. Do we know it might, we might first need to know what the condition is. They told us what the condition is caused by, but maybe first let's figure out what that condition is. 2, what is the organelle involved in that condition or that defect? And then 3, what is a function normally done by that organelle? So I think 1, the condition, 2, what's that organelle, 3, what is the function of that organelle? Okay. So let's go ahead and take a look at the answer choices. Once again, we have 5 answer choices. We're going to go ahead and start at the bottom, work our way up to the top. E, protein synthesis. D, protein modification. C, lipid and membrane biosynthesis. B, degradation of cellular materials. And A, beta oxidation of long-chain fatty acids. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer. Talk about it in just a few seconds.
Okay, everybody, the poll has been launched, and we'll give you a chance to think through this one. Again, there's no reason to leave a question unanswered on test days. So even if this is new material for you or something that you're a little unsure about, give it your best shot, and we're going to walk through it. Again, whether you get it wrong tonight doesn't really matter. What matters is that you get it right on test day. Okay, well, we've gotten a good response so far. Over half of you have voted, so let us see. Once we get to about 2/3 of you participating, we will shut down the poll and share the results. Looks like we've got another interesting split here amongst the audience. Okay, well, we've had 70% of you voting, so I'm going to close the poll. And let's share the results. So let's see here. A little over 1/3 of you went with answer choice B, degradation of cellular materials, whereas protein modification came in second, and beta oxidation of long-chain fatty acids trailing in third. So again, no clear majority here from the crowd. So let's hide the results and learn what the answer is. And the answer is D, protein modification. So again, this is, I think, the second time where the choice with the second most votes was correct. So let's figure out what happened with this one. Paris?
Yeah, thank you, Jeff. Yes, another tough question here. So let's take a look at what's going on. So this patient has a few things going on. So they're telling us that this patient has a defect in that specific enzyme, okay? And that enzyme, that defect occurs in the Golgi apparatus, okay? This is a defect in the condition of eye cell disease, okay? So let's look real quick. We'll see, this patient says has club feet, coarse facial features, enlarged gums. Let's take a look at the next slide, and I believe there's a slide on eye cell disease and cell trafficking, okay? So if you look at this eye cell disease, you can see it has a defect in that specific enzyme. Right in the middle there, it talks about a defect in that N-acetylglucosamyl phosphotransferase. So basically what's happening is the Golgi is not phosphorylating certain things. It is not phosphorylating mannose residues on glycoproteins, okay? Those enzymes get secreted outside the cell as a result, instead of going to the lysosomes. Thus, the lysosomes are deficient in digestive enzymes, so you get a buildup of cellular debris in lysosomes. So this is maybe why a lot of you guys picked answer choice B, okay? You can see there that eye cell disease can result in coarse facial features, gingival hyperplasia like our patient. But it's important to keep a note, the defect here is actually in the Golgi apparatus. It's the Golgi apparatus that has failed in its job to phosphorylate those mannose residues, okay? That's what ends up causing those enzymes to go out of the cell instead of the lysosome. So the Golgi is the one who failed us here, okay? The Golgi complex normally is responsible for protein modification. It adds little tags onto proteins and lipids so it knows where to go, kind of like your post office a little bit, okay? So if we take a look back at our question, we can see there that if we look very closely at that lead-in, the enzymatic defect occurs in what organelle? The defect itself is occurring in the Golgi. Eventually, you get issues with the lysosome, but the defect itself is occurring in the Golgi. And that Golgi normally performs protein modification. So hopefully you see why answer choice D is the best answer and why B is kind of a tricky answer choice, but it's actually incorrect. Answer choice E, protein synthesis, that's actually where that takes place in the rough endoplasmic reticulum. So a little bit different. Answer choice C, this is the function of the smooth endoplasmic reticulum. Answer choice A, this is within peroxisomes. All three of those are kind of red herrings, not relevant to this question. So hopefully you guys are able to pick up on what was going on in this question, that it was eye cell disease, but also just how important it is to make sure you're not reading over that lead-in too quickly, because there's a lot of subtle clues there that can help you, in this question, would have helped you pick D over B.
Excellent. Thank you, Paris. And this is, yeah, like you said, this is a perfect example of why it's so important to really dissect the vignette, kind of figure out what's relevant, what's pertinent, what are the things that will point you to the right answer. So, you know, a lot of valuable, high yield stuff that we're talking about tonight. So we are now leading up to our final question of the night. Definitely want you guys to finish strong. We've definitely had some good, tough questions tonight, and hopefully this is helping to sharpen your test taking skills. So let us go into our fourth and final question. Again, after this, we're going to have our special raffle, as well as announcing the first winner of the RX for Life contest, and also special offer for all of you guys in the audience. Okay, question 4. Again, we are going to start by looking at the lead-in. Which of the following is another function of the organelle most likely being studied by this researcher? Got a lot of organelles tonight, so think about that. Let's read the vignette. A researcher is studying neurologic disorders by examining the functions of a cellular organelle linked to a myelin synthesis disorder. The researcher finds that during experiments, the organelle breaks apart long-chain fatty acids at every second carbon. However, there is no activity when short-chain fatty acids are present. So the question, which of the following is another function of the organelle most likely being studied by this researcher? If you want to take a shot at seeing how many steps you think it would take to answer this question, let us know in the question box, and we'll turn it over to Paris. Paris.
Thank you, Jeff. So lastly, with this question, we're going to show you what we think are the important clues in this vignette and the lead-in. And so this is our fourth time doing this tonight. So, you know, the reason we're showing you this is that when you guys are working through your questions and dissecting your questions, hopefully you'll be able to pick up on what things are important to highlight, make note of, and synthesize, and maybe what things are important to push a little bit to the back burner, okay? And especially with that lead-in, you know, we can see just how tricky those lead-ins can be with what they're asking. So we need to be very, very cautious, make sure we're reading it very closely, exactly what they're asking. Okay, so hopefully this practice of doing that a few times tonight has been helpful for you guys. So we're going to go ahead and do that one last time in this question. So we know that there's a researcher studying neurologic disorders and examining the function of a certain organelle. Okay, they tell us a little bit more about that organelle, what it does, and then also what happens in what situation it doesn't work, okay, when there's no activity. All of these are clues as to what is that researcher doing, okay? So then they're asking us, what's another function of that organelle most likely being studied? So I think you guys probably are able to pick up on this, but I think maybe a two-step question. One, what is that organelle that's being studied using the clues in the vignette? And then two, what is another function of that organelle? So I think we have a nice two-step question here. So let's go ahead and take a look at those answer choices. And once again, we are going to start at the bottom and we are going to work our way up to the top. Answer choice E, oxidative phosphorylation. D, hydrolysis of peptides. C, carbohydrate storage. B, bile acid production. And A, autolysis of the cell. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer. We'll talk about it in just a few seconds.
Okay, thank you, Paris. So we have launched the poll. Final question of the night. Let's finish strong. Again, not exactly a straightforward question, but does definitely force you to kind of think through this. So we'll give everyone maybe another 10, 20 seconds to register their vote. Which answer do you think is another function of the organelle most likely being studied here? Looks like a favorite is emerging within the results, but there are a couple of options also that are collecting some votes too. So let's see, a little over 60% of you have voted. Let's try to get a few more of you in here. Again, never hurts to take a guess on test day. You will not be penalized for it. Okay, so we are nearing 70%. So I'm going to close the poll and we're going to take a look at the results. And it looks like almost 2 out of 5 of you chose option E, oxidative phosphorylation. And there's kind of the runner-ups between D and B. So let us hide those results and see what the right answer is. And the correct answer is B, bile acid production. The one that had garnered the third most votes turned out to be the correct answer. Well, let's break this one down, Pars. What do you know?
Yeah, absolutely, Jeff. Definitely another tough question. I think you guys are seeing a theme here. These cell biology questions can be pretty tough. So it's important to know it inside and out, absolutely. So let's take a look here. So what organelle is this researcher studying? Well, the organelle that they're studying is most likely peroxisomes, okay? These are responsible for fatty acid oxidation. They tell us that that organelle breaks apart long-chain fatty acids, has no activity with short-chain fatty acids, okay? Let's take a look at the next slide, and I believe there's a table on specifically peroxisomes. So you can see there that it is a membrane-enclosed organelle involved in the oxidation of long-chain fatty acids, okay? You can also see there that it is involved in that fourth bullet point in the synthesis of cholesterol, bile acids, and plasmalogens. And there is also, third bullet point, catabolism of amino acids and ethanol, okay? So this is what it was getting at. These are peroxisomes, okay? They also convert hydrogen peroxide to water and oxygen to cut down on the damage from reactive oxygen species. And you can see there are some of the conditions that you can see clinically if you have disorders of paroxysms, okay? So now hopefully you can see there why bile acid production is the correct answer, okay? Let's take a look at the other answer choices, why those would be incorrect. Oxidative phosphorylation, that is the process of making ATP. That occurs in the mitochondria, okay, not the peroxisome. Answer choice D, hydrolysis of peptides. This occurs in proteasomes, okay? Proteins can be marked for degradation by ubiquitin, and then they enter into a proteasome, which hydrolyze proteins into peptide fragments. Answer choice C, carbohydrate storage. This would be potentially the smooth endoplasmic reticulum. This is not responsible for fatty acid oxidation. And lastly, A, autolysis of the cell. This is a function of lysosomes, okay? They act to digest the cell from the inside. This is a form of apoptosis. And again, not the organelle that's being studied. So hopefully you guys are able to pick up on some things in regards to cell bio today and how to attack some of these questions. And I will pass it over to you, Jeff.